Hi there, I'm Dr. Bill White again with the American Orthodontic Society, and I wanted to kind of fill in a place here in our videos that a lot of people ask questions about how we move these teeth and get them closed space like that, and you don't just lean the tooth over this way, so we bring it forward and bring the roots along with the crown. And that bothers some people, and they wonder how this is done. But let's just say we're going to close this space, and we don't want to move these teeth back to close the space. We want to just bring the back teeth or the posterior teeth forward. And I don't know, I'm going to show this, but we put a little, if we want to keep these teeth where they are, we go into the cortical bone here and put a little screw in this area and bond it to the tooth right there. And you have it actually kind of slope this way so that you can pull this tooth all the way up and virtually touch that one and not mess up the little screw. If I got in there, I'm going to try to erase that before it dries on there too much. All right, we'll get back to working on this. Now, if we want to bring these teeth up where they're just parallel, then you've got to come in with an arch wire. See, it's got this little loop like this, and then it goes down to the side that way. Now, if you just put the wire in there without the loop or anything, or you're not, or you put this in, and this wire kind of, it's a spring here. This just, I have it in there, and you pulls down this way. And if we just stuck the wire in there and didn't tie it back, then this tooth would move down this way, and then, but you've got to tie it back through the hole in there, and then you go back to the last tooth back here and tie this up where it can't go back, and you close by pulling this closer and closer to that, to this little circle. Now, and as this gets closer, you may want to shorten the wire up here, and so this stays fairly close to the same center. So as we tie the wire back here, these two teeth will just move forward like this. And if I pulled on this wire and didn't have this bend, they would tend to come over like this. Like if you just pull on it with a wire, this thing is going to rotate down this way. But that's not what we want. We want the whole thing to come forward. So we put this activation in this little spring like this, and you put it, you break it up, and if you didn't pull on it, it would move the teeth this way. So we pull on it, and if the tooth starts to move too much this way, then we've got more pressure than we need here, or we don't have enough activation in this spring right there. So this is the way we close space on all these cases. We don't all the time use it exactly the same way, but we can activate this and it'll pull a tooth, especially if you just got one tooth. It'll still, instead of it doing this, it just gradually moves up here. Now if you didn't mind the front teeth going back as you bring this forward, it'll pull the whole front teeth all the way around from bicuspid to bicuspid, would go back some, but not much. So most of the time when you're closing space, you've got a little protrusion in here, and you don't mind closing or having these go back. But if you don't want them to move back at all, you go in the cortical bone outside of this bicuspid and put a screw in there, and then you bond that screw to the tooth, and it will pretty well stay right there as the teeth move up here, and then you shorten this wire and pull this around and keep that little circle in that space, and you can bring these teeth together right here and not have that move back at all. And we're talking about cases like this. Adults, closing space on adults is a good example of that. Or we've got other videos on there where we close space, and you learn how to tie this back. You go through here with your tie wire and go around the back side of this and pull up, and then you tighten this up. But you have to go on the other side of the mouth now and tie it back first, and then you tie this one back and really pull on it, and it'll move these teeth back, but not the other. But it'll kind of pull the whole thing a little bit that way. But we can slide teeth from the back toward the front without really distorting the case at all. And this is one of the secrets of it. Now, if you want to move this, you have to bend a little U-shaped thing in the arch wire itself. Like if we want to shorten it on both sides of it, we just bend the wire down and come back up like this, and then straighten this back out again. I'm shaky. All right, now that'll shorten this wire as much as I go down and up over here. It will bring this loop forward. So as you close a big space in there, you need to move the wire, shorten the wire as you come on. And as long as this is not the right kind of spring there, but you can close space anywhere on almost anybody's teeth unless they're ankylosed, and you can just pull that together. So that's what I have a lot of people write back and want to know how we brought these things together, and I thought I'd just sit down and talk to you a little bit and show you what to do. So thank you for watching, and I'll hang up here. Bye-bye.